I would like to now introduce our guest speakers for tonight, starting with Christina Lee. Christina has worked at Unity Health Toronto, Providence Healthcare since 2004. She was a member of the geriatric outreach team for several years, providing community-based assessments in Scarborough and East York, and in 2018, joined the patient flow team. Since June 2021, she has taken on the role of patient flow coordinator for the Outpatient Post-COVID Condition Rehabilitation Program. Our other guest that I would like to introduce this evening is Monica McCullagh. Monica is a longstanding staff member at Providence Healthcare with over 15 years of experience. Monica began her Providence journey as a clinical resource coordinator in the adult day program, supporting individuals and with irreversible memory loss before transitioning to the role of community health navigator, where post-discharge follow-up with patients was the main focus. Most recently, Monica has embraced the additional role and responsibilities of facilitator for the post-COVID-19 condition therapeutic education and creating connection sessions. Monica finds this work extremely rewarding and is passionate about helping people in the community. Last but not least, I would like to introduce Sonya Torreiter. Sonya is a speech-language pathologist at Unity Health Toronto. Sonya works both at St. Michael's Hospital Head Injury Clinic and at Providence Healthcare Outpatient Post-COVID Condition Rehab Program. Without further ado, please help me welcome our guests. To our guest speakers, whenever you're ready, please take the floor.
We've already had our introductions. I'm Christina, and a coordinator in the Unity Health Toronto Post-COVID Condition Rehab Program, which is based at Providence Healthcare. And I'm joined by my two teammates tonight, Sonya and Monica. So we're very excited to be able to share with you some of what we have learned so far in our experience working with post-COVID patients over the past year and a half, and hopefully shed some light on the current approach to managing this condition, which is new to the medical and scientific community. So you can imagine even more poorly understood by the general public. Just a quick overview of what we plan to touch on in this hour. We'll go through a bit of an introduction, a primer on what is post-COVID-19 condition, or as it's more commonly referred to, long COVID. We'll talk about the overall approach to care and treatment of the condition, and then go into a bit more detail about some of the symptoms of long COVID and their management, and have time for questions. The Unity Health Toronto consists of 3 sites, St. Michael's Hospital and St. Joseph's Healthcare Centre, which are acute care hospitals, and then Providence Healthcare, which is the rehabilitation site. And there's also a long-term care residence at this location, separate from the rehab hospital and clinics. The outpatient post-COVID program started in June 2021 and was initially opened to serve the patients who were being discharged home from our inpatient rehabilitation units. Many of them had had severe COVID illnesses, were in hospital for a long time, perhaps had been in the ICU. And as they reached the point where they were ready to return home, we could see the need for additional outpatient rehabilitation to help them continue on their journey of recovery from COVID. So that's how it started off. However, as time went on and we opened up the program to outside referrals, a very different group of post-COVID patients presented itself to us. And these were people who had had milder COVID illness, were in the community and didn't have to be admitted to the hospital with COVID, but they were still very debilitated for weeks and months afterwards with a variety of symptoms. And now coming up to a year and a half later, over 90% of our patients fall into this non-hospitalized group. So there's been a lot of learning as we go, trial and error, and knowledge gleaned from our patients' experiences that have led us to where we are today, aiming to share some of these learnings and increase awareness as much as possible as to what individuals with post-COVID condition are experiencing and how we as family, and how we as family, friends, employers, and fellow community members can support them in their journey. So to provide context and ensure we're all starting off with the same understanding, this is the World Health Organization's definition of post-COVID-19 condition. It is quite lengthy, so we've broken it down here to highlight some of the important components. So post-COVID-19 condition occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset of their COVID-19 illness, with symptoms that last for at least 2 months and cannot be explained by any other diagnosis. Common symptoms include fatigue, shortness of breath, cognitive dysfunction, but also others, and generally have an impact on everyday functioning. Symptoms may be new onset following their initial recovery from an acute COVID-19 episode, or they could persist from the initial illness. Symptoms may also fluctuate or relapse over time. This is a busy diagram and not meant to go through it in detail, but just putting it up to illustrate that post-COVID-19 condition has been reported to affect essentially every organ system, with over 200 different symptoms that have been observed. To highlight some of the most common symptoms, these are the ones that we often hear about from our patients: fatigue, cognitive changes, anxiety and depression or changes in mood, respiratory symptoms such as shortness of breath with minimal activity or even at rest, persistent cough, dizziness, muscle and joint aches, chest pain, high heart rate, and post-exertional malaise, which we will talk about in a little bit more detail later. These are some other symptoms that we might not naturally connect with an illness like COVID, but nevertheless, they have been very commonly reported by individuals with long COVID. So loss of taste and smell, swallowing issues, sensitivity to sound, light, and screens, changes to hearing or vision, weight loss or gain, a lot of GI symptoms, acid reflux, voice changes, rashes, and new allergies. So really quite the spectrum of symptoms. So how is long COVID diagnosed? An important thing to note is that a positive PCR test is not required for a diagnosis of long COVID. Only some individuals are now eligible or recommended to get PCR tests. So some might do a rapid antigen test at home, and others may have a known exposure to someone with COVID, and so they would presume their illness is COVID without doing any testing. The process for diagnosis of long COVID does start with seeing one's family doctor. And based on the specific symptoms, the family doctor may refer the person to some diagnostic tests or certain specialists to rule out other potential causes for these symptoms aside from COVID. And it's usually not until all other causes are ruled out that the doctor would make a clinical diagnosis of long COVID. Certainly, this can be a long process and frustrating to go through multiple appointments and tests and not find anything abnormal. But this process is necessary to ensure that your healthcare team isn't missing any other conditions that do require treatment. As I mentioned earlier, the Providence program opened at the end of June 2021, and we had a number of expectations based on the pandemic so far. And so when we were thinking about who we would be seeing with long COVID, we had some misconceptions in retrospect. So we had expected to see older, more frail individuals because during the first waves of COVID, these were the people who were largely affected. We also expected to see people with pre-existing conditions who might be generally less healthy, perhaps have weaker immune systems, and be more susceptible to the lingering effects of a virus. So who did we actually see? What you can see here, just some statistics from our program so far, is that in the first year and a bit running, about 80% of our patients fell into the group who had mild to moderate COVID illnesses and were never hospitalized. And in terms of age, we found that 85% were between the ages of 18 and 64. So not the older, frailer age group we were expecting. And looking at a larger group of patients, including those on our wait list, a similar pattern is seen, with 87% non-hospitalized patients and 88% being within that 18 to 64 age group. And some examples of who we have seen in our program are a 20-year-old college student, a 37-year-old single working mom, a 52-year-old contractor, a 72-year-old retired accountant. So from what we have seen, long COVID is certainly not contained to any specific group by age or health status, et cetera. But whether hospitalized or not, several aspects of life may be impacted by post-COVID symptoms. And what we have seen across our patients is a reduced ability to perform daily activities, for example, showering, cooking, shopping, managing finances, a reduced ability to care for children or other family members, such as aging parents, and definitely a lot of stigma where these individuals often feel unsupported and abandoned by the medical field and the community due to the lack of objective findings on their medical tests and during consultations. They have difficulty returning to work or school, and certainly there are many negative psychological and financial impacts that come along with these situations. Oops. So the approach to care and treatment. Since the symptoms of long COVID can vary greatly from person to person, especially as we've seen, there could be effects in almost any system of the body. We have seen that some aspects of long COVID are similar to other chronic conditions, such as chronic fatigue syndrome, post-concussive symptoms, and dysautonomia. So some of the specialist consultations that a person's family doctor may refer them to could lead to some medications being prescribed to manage specific symptoms, as well as further testing such as cardiac tests, lung function tests, sleep studies, and some imaging such as ultrasounds, for example. Unfortunately, there is no magical pill or cure for long COVID, and the timeline for recovery is unpredictable. This is why it's so important for people with long COVID to have a support system to help maintain their mental health as they continue to live with this condition. And what we have found most beneficial to our patients and what we offer in our program is a self-management approach. So in terms of the Unity Health Toronto program, the foundation of our program is our Therapeutic Education series, which is delivered virtually to groups of patients. The 4 modules in the series cover the topics of what is long COVID, physical activity and exercise, thinking, memory, and attention, and managing emotions and building resilience. There is an optional peer support group called Creating Connections, which is an opportunity for participants to share experiences, strategies, challenges, learn from, and support one another. There's also the potential for some individual or group health discipline sessions if it's deemed necessary when we review the patient's referral and their intake questionnaire. And our team consists of PT, physiotherapy, social work, occupational therapy, registered dietitian, speech language pathologist, and a physician who is a physical medicine and rehab specialist or a physiatrist. The majority of our visits are virtual, which is great as many patients live far from our site or their energy level might be too low for them to attend in-person appointments without worsening their symptoms for several days afterwards. So next I will hand it over to Sonya, who will talk about some of the common symptoms of long COVID that we address in our program and the approach to managing these symptoms.
Hello, everyone. I'm going to start with fatigue. And the fatigue that's associated with long COVID means that the person has less energy or feels tired all the time, even after resting. The amount of fatigue the person may feel does not reflect their level of exertion. So normal activities cause much more fatigue than would be expected. People can experience physical fatigue and mental fatigue. Signs of physical fatigue could include sleeping more than usual, finding it hard to walk or stand, and getting tired much more easily than usual. Signs of mental fatigue include finding it hard to concentrate, having trouble remembering things, or difficulty finding the right words to express yourself. People experience fatigue after a viral infection like COVID-19 because it has affected so many different systems in the body that are involved in the production of energy. And as a result, the body is not always able to meet the energy demands of the physical, cognitive, and social activities that people are participating in. The fatigue is not happening because the person is out of shape. There are many other physiological reasons contributing to these symptoms that cannot always be fixed with exercise. And in fact, continuing to exercise can make things worse. Traditional rehabilitation often focuses on gradually increasing the amount of exercise or exertion, or the level of difficulty of an activity to promote recovery. However, increasing amounts of physical and cognitive activity may not have those benefits in people living with post-COVID condition. It may actually have adverse effects and contribute to worsening of symptoms. For people who have issues with fatigue, an additional complication may be something called postexertional malaise or postexertional symptom exacerbation. This is a disorder of energy production and use at the cellular level. There are some similarities between what we are seeing in people with long COVID and those who have chronic fatigue syndrome. The pattern is an energy crash that happens hours to days after physical, cognitive, or emotional exertion. severe fatigue, worsening of other symptoms that we've already mentioned, including chest pain, shortness of breath, dizziness, and brain fog. People describe this kind of crash as feeling as if they're wearing 3 lead aprons in radiology, or that they've had cement poured into their legs. If unmanaged, this pattern of repeated crashes has the potential to do long-term damage. So when people are encouraged to just push through or try to build up their strength, it has the potential to do harm. These are a few examples of the kinds of activities that have triggered post-exertional malaise for our clients. They range from the ordinary daily tasks like carpet shopping to events like shopping for a graduation dress with your daughter that might be very meaningful and important to you. It's necessary to know more than just a person's single activity tolerance. Can you walk the dog for a few blocks each morning? Yes. But if you do your usual dog walk plus 15 minutes at your child's curriculum night, perhaps you have a crash. Moving on to managing post-exertional malaise. It's important that when someone is experiencing a crash, they not push through it. Increasing physical activity or exercise will not make things better and will likely make things worse. In the program, we encourage people to use a stop, rest, pace strategy to prevent further harm. Stop includes trying to decrease participation in physical, mental, and social activity as much as possible. This can be challenging due to caregiving and financial responsibilities, but every little bit counts. Rest. People are encouraged to try to increase their rest time until they start to feel better by incorporating more frequent restorative and relaxation activities into their routine. This might include breathing work, meditation, listening to calm music, or any other activity that they find is relaxing for them and that uses minimal physical or mental energy. Pacing means gradually reintroducing activities into their routine at a pace that does not cause a crash again. It is important not to go back to the previous routine too soon. In the program, we use the analogy of a fuel tank throughout the education modules. People are encouraged to think about how much fuel they have in the tank at a given moment and how much they need to preserve for later on, recognizing that physical, emotional, or mental tasks all require fuel. Because there aren't any medications or procedures to specifically treat long COVID, our program focuses on providing people with education about the illness and about how to manage their symptoms themselves. The pattern is often to try to accomplish as much as possible on a day the person feels good, with the result that the next day they have a crash. So we try to stabilize that pattern to stop the roller coaster. People learn to stay within the limits of their energy, changing their activity level based on their symptoms, pacing their physical and cognitive activities, learning to recognize early signs of fatigue. We recommend against increasing activity levels until there has been a substantial period of stability. If clients are ready to return to work while they're in our program, we help them to put together a plan that allows for a gradual increase in their hours and workload, and they may need accommodations from their employer. Many of the messages that clients receive in our program run counter to what we grow up thinking and valuing. This word cloud includes some of those beliefs: lean in, productivity, just do it, triumph over adversity, never give up, resilience, and I'll sleep when I'm dead. It's often difficult for clients to feel good about behaving differently. People often feel lazy and valueless and sometimes receive some of these unhelpful messages from families, employers, and even healthcare. This may mean getting back on the roller coaster a few times before accepting the need to use pacing strategies consistently. Another common symptom is breathlessness. This might feel like not having enough air to breathe properly or getting stuck when trying to take a deep breath. Some of the reasons for breathlessness could be changes to the lungs, hearts, and voice box as a result of COVID-19, low blood oxygen levels with exertion. There could also be changes to the nervous system, particularly the autonomic nervous system, which regulates automatic processes in your body, such as your heart rate, digestion, body temperature, and breathing rate. Approaches to managing breathlessness are taught in the program, including specific breathing techniques and mindfulness. The next symptom that we will touch on is brain fog. People describe feeling that their mind is slow or fuzzy or spaced out. We've all experienced some form of this before, whether from taking a medication that made you feel drowsy, staying up too late, or jet lag. But these feelings typically pass when the medication wears off or when we get enough rest or adjust to a new time zone. Symptoms of brain fog can linger and last for months after a diagnosis. About 30% of people living with long COVID report problems with their thinking or brain fog. Someone experiencing brain fog may have trouble remembering things, find it hard to think clearly or as quickly as usual, have trouble concentrating or focusing on a task, find it hard to make decisions or start tasks, have trouble with communication, or have headaches. Brain fog might make it hard to manage chores at home. People often talk about feeling overwhelmed by tasks. It can affect the ability to manage finances, organizing when or how to complete tasks. At work, people report that they have trouble concentrating, trouble multitasking, and that interactions with colleagues can be overwhelming and fatiguing. Social interactions and leisure activities like movies and clubs may become more difficult. Caregiving is an important role for many people, caring for children and parents or friends. It becomes more difficult to be present with someone or to organize someone else's schedule or care. To return to the analogy of the fuel tank, it's important for people to begin to recognize the degree to which mental exertion can deplete the tank just as much as physical exertion. Sometimes people find that once they've completed self-care activities, there isn't much left for other things like work, social interactions, leisure, or even thinking. When people begin to run out of fuel and dip into that red zone, they may experience an exacerbation of symptoms like brain fog, headaches, digestion issues, shortness of breath, and heart palpitations. In the program, people learn strategies to support attention, memory, and communication. A key strategy is cognitive pacing, learning to stop before the onset of fatigue, learning to stop while you still feel okay. Cognitive pacing also involves taking frequent breaks during cognitive activities. These should be complete breaks, perhaps to do some breathing exercises, have some tea, spend time with pets, but not just to do a different task. Problems with cognitive skills like attention and memory often affect communication, speaking, listening, reading, writing, and the social aspects of communication. People experience difficulty finding the right word and expressing themselves clearly and articulately. Memory problems lead to forgetting a conversation or to repeating something they've already said or asking a question more than once. Many people struggle to concentrate on reading and writing. They may find it hard to find the motivation and energy to socialize and withdraw from friends and family. Most people can have a short conversation and even sound like themselves for that period of time, but as fatigue increases, they may have difficulty continuing. People often describe hitting a wall or feeling that their brain shuts off. Speech might get slow and effortful, and it's hard to process what other people are saying. When someone is experiencing that kind of a shutdown, the only option is rest. In the program, the longer-term goal is to prevent those episodes from happening by managing fatigue. Communication, like other cognitive activities, is a form of exertion. So people learn to plan these activities accordingly, with breaks between and during. Sometimes activities can be simplified so they take less energy, perhaps seeing someone one-on-one rather than in a group, and at home rather than in a noisy restaurant. At work, it's important to manage the environment and to reduce distractions. For example, setting up do not disturb while working on a project. Communication often needs to be given full attention, so no conversation while driving or cooking or watching the kids. And now I'm going to turn the talk over to Monica.
Hi, everyone. I'm Monica. I'm going to go over some common nutritional concerns and emotional experiences, and then we'll open the floor to questions. So a common nutrition concern is low appetite. This can be due to taste and smell changes, altered hunger cues and fatigue. An approach we recommend is to have small, frequent meals or snacks or high energy foods to help fuel against fatigue, prevent energy crashes, and to regulate appetite and hunger cues. This is when some clients may have to do mechanical eating, so even when they aren't hungry, to bring back a consistent eating pattern. Weight changes happen as well. Weight loss can occur with the low appetite as well as loss of muscle mass from decreased activity. In these cases, we prioritize increasing protein intake and high energy foods when appetite is low to preserve muscle mass. Weight gain can also occur because of decreased activity and metabolic changes, inflammation, and increased stress. This is when we focus on having balanced meals. There are a number of gastrointestinal issues that weren't present before or have become exacerbated as a result of long COVID. Bowel changes include diarrhea and bowel urgency and/or constipation. Other GI issues include reflux and bloating. The strategies to manage GI concerns are individualized based on a client's symptoms and needs, but some common approaches are to adjust meal timing and composition, so high soluble fiber or low insoluble fiber, reducing inflammation and using a probiotic. Some common emotional experiences. So people living with long COVID may feel frustrated with the lengthy diagnostic process and the lack of answers available once diagnosed. They may be hard on themselves. They may be frustrated with not being able to do the things they once did. Things are more difficult or take much more effort. They may feel sad due to loss of independence. They may worry about being around other people, lack trust in the community. They may feel afraid of public spaces and public transportation. They may also be afraid that their illness may come back, worry about their family's health, be concerned about returning back to work or school, worry about their finances. They may feel angry or upset at their current circumstances, and they may be anxious or depressed. So now we'll touch on the importance of validation. Most of the symptoms and conditions affecting people with long COVID are invisible. Traditional test results are often within normal limits. Long COVID is unfamiliar even to many health professionals. Patients often come to us with months or years of experiencing skepticism, even from family members or their longtime family doctors. Being accepted to a long COVID program where clinicians start from a point of belief and there are peers experiencing similar challenges may be the first time that patients feel validated and not alone. What can be done to help someone with long COVID? So ask what you as a family or friend can do. Ask someone directly how you can help. Can you do some groceries for them? Maybe they need someone to attend an appointment with them. Be open and honest about how you can help. Support from family physicians. Family doctors are now becoming more experienced with and aware of the management strategies for people with long COVID. More resources are available now to be able to support their patients in the best way possible. Making work accommodations. Work accommodations are a key part of managing long COVID, reduced hours or days of work. However, in some cases, this is not possible. For example, a single parent who is the primary source of income. In this case, a person must make adjustments to activity outside of work to allow for rest. And this can be very difficult or almost impossible for some people. Support individuals in the efforts to pace and reduce their activity level. Be patient and caring. There may be bumps in the road. Some days will be better than others. Support a person's need to plan, pace, and prioritize, and remind them to stop before they get tired. So the importance of self-care, a strong support network is a great benefit. As the community becomes more aware of what long COVID is, we will be able to better understand and support people living with long COVID. So now we have a list of some resources. I understand that participants will be sharing the slide deck with them, so don't worry about writing all those down. They will be sent to you. Okay, we're ready to open the floor for some questions.